we recently received a grant from the Bill and Melinda Gates Foundation and the United Kingdom's Department for International Development, or DFID, to study food safety in Ethiopia. The goal of the grant is to provide better understanding and help them allocate their resources around food safety. So there's three main areas within the grant. The first area is looking at the burden of foodborne disease in Ethiopia. They don't really have a great handle on how much illness that they have. And when you're thinking about how to allocate resources, understanding the burden of disease is really important. So we're going to be working with some of the universities in Ethiopia, as well as some of their public health agencies, to use hospital records and hospitalized cases to develop estimates, and then also supplement that with surveys of healthcare practitioners and community to develop multipliers that we will then use to scale up to get overall population estimates of foodborne disease in Ethiopia. In the second part of the grant, we're going to be looking at risk management practices. In Ethiopia, a lot of people consume raw beef and raw milk, which are very risky products from a food safety perspective. We're going to be working with those two supply chains to develop some intervention strategies that would make the products safer than they currently are. So I have one of my collaborators, Ahmed Youssef, who's in our department at OSU, and then I have a collaborator at Addis Ababa University and the University of Florida. We're going to be working together to evaluate 4 different intervention strategies, and then we're going to conduct some risk assessments to look at what would be the impact of implementing those wide scale in Ethiopia. You want to have an idea of that before you invest resources in actually rolling things out broadly. And so Mark Weir from the College of Public Health is going to be working with us, along with Rob Scharf. We're going to be working together to conduct those risk assessments and develop those cost estimates. The third part of the grant is then to actually work with policymakers in Ethiopia. So work with the government agencies and then with the stakeholders to lay out to them, here's the burden of disease from various pathogens. We're going to need to focus. They don't have a lot of resources. And so what you often will do in that situation is you will rank risks. So you use the burden of disease estimates to rank those risks, and then you use the information from the risk assessment to help them understand where the interventions, which interventions might be more effective overall. And then you take into consideration other things like cost, feasibility, and so forth. In that part, you have to engage stakeholders and you go through a prioritization exercise. And the idea is that this will enable Ethiopia to then move forward themselves. They will have a better understanding of how to use a risk-based approach to food safety, and they'll have the framework to start deciding how they're going to allocate their resources going further.